Hi, it's Dr. John Day here, the Regional Primary Care Lead for the Erie St. Clair Regional Cancer Program. And we're here to talk about the Do What You Know campaign. It's a campaign to try to get people better screened for cancer, and it is a collaboration of my visits to a whole bunch of different offices and all of their pearls of wisdom about screening. Here in the waiting room, the simple answer people have told me is make your waiting room an efficient worker that tells patients what tests they need. You do that with big posters, or you do that with information pamphlets. While they're waiting to get in to see you, they have the information that helps you get the job done with respect to their screening. As we move through the other areas that the patient's visits, hopefully we'll be able to also make the rest of the office more efficient with respect to cancer screening. The exam room is where most physicians are doing the screening conversation with their patients. And the really good screeners are using two main techniques. Firstly, they're using a preventative care checklist or standardized form for their annual health exams. This allows them to be prompted and gives them the exact information that is needed to determine which patient needs what test. Certainly people with electronic medical records have easy access to those forms. Others are available from the CCFP or give us a call. The other high screening tip that people use is to add at a certain time of year end of the visit screening assessment. While you're finishing up with details of prescriptions or other paperwork, you ask one or two questions to prompt the patient to get their screening test done. You have in your exam room all of the forms and requisitions, and have your staff print labels for inside the chart if that's the case that you're using, so that you can quickly give them their screening test requisitions as they leave for whatever problem they come in for that day. Here we are in the reception area, and we all know this is where the real hard work of screening begins. The front office reception staff and the nursing staff have to go through the many lists that we're given that give us the patients that require certain screening tests. The colon cancer check or screening activity report, the EMR list that you can generate by yourself, or the Ministry of Health Preventative Care bonus forms are all used by various offices. The offices that are really good at this do two things very well. They have a place in the patient's record that shows which screening tests have been done. And that is necessary to cross-reference with the list so that when a patient comes in for a visit, or if you're deciding to mail them something, you can quickly ascertain which tests that they need. It saves a lot of trouble when the patients know exactly what they need done and the staff know exactly what needs to be done. The other key element to making this successful is quality billing. The codes that are done for screening tests are often done when you complete a screening test, but they're also often done when the test results come in. Please make sure that either reception staff or doctors are going through the test results carefully and sorting out the ones that need their preventative care bonus Q codes, as we call them, done. And please make sure that you continue to do this on a day-to-day basis, because every year your lists will get better and every year your billing practices will be stronger. Please contact the number if you have any further questions, because we'd be more than willing to help share some of these technical details for people, and we hope that this will allow everybody on the healthcare team to make screening easier, screening more efficient, and to improve patients' health.